Hello, my name is Amber Kerrigan, and I am a program manager with the Twin Cities Medical Society, joined today by Christopher Prokosch, an MS2 at the University of Minnesota Twin Cities Medical School. Christopher, thank you for joining us today. I'm really excited to hear about the MD Link, an organization that you are one of the co-founders. And so I would just love to hear a little bit about how the idea for the organization came about.
Well, Amber, thanks for having me. So basically, this organization started one day in my first year of medical school, walking to HCMC over by the Viking Stadium. And as you walk there, you walk by the Hennepin County Juvenile Detention Center, which is this huge gray government-style looking building. And it is hard. It's hard to look at, knowing that its alleged intent is to help youth and reduce crime and inspire development. It doesn't give me that energy. And so basically a few of my classmates, including one of my friends, like current first year, who's actually had lived experience with homelessness, we got together and talked about, okay, what can we do as medical students, right? So what can we do to help youth and be a part of change and progress? So we reached out to a few organizations in the metro area, one of them being the Link Minnesota, another of them being Rebound Incorporated. And so they're serving youth who are or who have been victims of the juvenile detention system, of human trafficking, of homelessness. And so these organizations are providing housing, they're providing counseling, support, basically helping them develop as people. And so we wanted to provide mentors through medical students. And so we've built kind of the infrastructure around a mentoring program so that youth can have a strong or a stable and supportive person in their life who is affiliated with the medical field and can help them develop as people.
That's awesome. So can you share a little bit about, you shared a bit about kind of what you do, what the mission is of the organization and what you hope to accomplish in the future?
Sure. So the mission of the MD Link, kind of what I've talked about already, is we're basically trying to be a bridge between the University of Minnesota and youth in the community, right? I think a lot of youth aspire to college, aspire to go to university and get a job, but sometimes the resources aren't there, the connections aren't there, the support isn't there. And so I think partnering medical students with youth in the community who have been encountering really challenging circumstances, they're going to be able to provide a strong support to those youth and help them navigate the world. And so that's kind of the goal. And then as we look forward, so Rebound and the Link Minnesota, they're dealing with thousands of youth in Minnesota. So there's a lot of need. And currently we've got 50 mentors, and we're thinking of expanding to other professional schools at the University of Minnesota, which I think will be able to strengthen the bond between the university and the community, and also help more youth in the process.
Absolutely. So many of our members at TCMS are well versed on the health impacts of homelessness, but for those who aren't as familiar, could you share why homelessness is such an important health issue, and specifically maybe how it impacts young people?
Sure. Yeah. So we know that homelessness is it's a social determinant of health, has really negative outcomes in health. It impacts physical health, right? You're exposed to the elements. You're in close quarters oftentimes where there's lots of disease. You lack access to a traditional healthcare setting. Additionally, mental health outcomes are really poor as well. There's a lot of anxiety and stress, and it's just challenging to even know where you're going to spend the night. That takes a toll over a period of time, even a day. And just a few statistics for you. So currently there are 13,000 homeless youth in Minnesota. That's a statistic from the Minnesota Homeless Study. And 1 in 5 youth who is homeless will be human trafficked as well. So these are really stark numbers that just demonstrate the huge need of youth that are experiencing homelessness in Minnesota.
Yeah. What's maybe one thing that the MD Link hopes that physicians and medical students, what they can understand about patients experiencing homelessness?
Well, so I can't speak for the homeless experience, but it's very apparent that providers and medical students, and truly all students, have a role to play in supporting youth that are homeless. There are so many things that we can do. Number one, read a book. Read a book about homelessness. For one, Evicted is an example. Number two, make sure that you're voting, right? Voting for representatives that are taking homeless issues into account and working to support those communities. Number three, there's so much to learn, and that's so many current projects currently happening in Minnesota around affordable housing, around street medicine, around recuperative care. So get involved, learn about what's going on, and use your voice, because some people realize, others don't, many don't, but physicians have a lot of influence in our community. And I just ask that you use that voice to really help these youth, because they need it. They need it pretty bad.
Yeah. So if people want to get involved with the MD Link, how do they go about doing that?
Yeah. So our current co-presidents are Michael Kelly and Emmanuel Fale. So I think we'll have their emails linked in the description. You can also join the Go for Link page. Additionally, we'd love to hear from any current or practicing physicians. If you're interested, have questions, want to get involved, we'd love to have you. Thank you.
Awesome. Thank you, Christopher.